Hi guys, this is Manoj Kumar Singh, and today is World Disability Day. This day is celebrated basically to create awareness about the rights of the people with disability. And for years now, I've been talking about rare diseases and disability caused due to rare diseases. See, there are many rare diseases which again are life-threatening diseases, and one of the symptoms or one of the results because of these rare diseases is actually partial disability, physical disability, or mental disability may happen, or even if proper treatment is not given on time, or treatment is not at all provided, patients have become permanent disabled. In this line, I'll be talking about hemophilia, a rare bleeding disorder. Again, what happens, those people who have heard about hemophilia, they only know that it is a royal disease, and that clotting doesn't take place in hemophilia. Blood clotting doesn't take place. Yes, this is one symptom, but along with that, in cases of severe hemophilia, spontaneous bleedings into joints, tissues, muscles happen, which again are reasons why patients suffering from severe hemophilia suffer from frequent joint bleeds, and if not treated on time, that is again the treatment is factor injection, factor 8 or factor 9, which again is very costly. And if they are not treated properly, the patients suffer from frequent bleeds, and that leads to deformity into the joints, or weakening or wasting of the joints, which again makes them disabled. Some are partial disabled, that during the time of bleeding they are not able to work through those limbs, and some have become, because of due to chronic bleeding conditions, have lost the strength into their limbs, or have now become permanent disabled. So, as per Rights of the People with Disability Act 2016, three bleeding disorders, hemophilia, sickle cell anemia, and thalassemia, have been added in disability list. But again, as the rights, some of the other disabled have been empowered through reservation of job into the government sector. But when we talk about these rare conditions, many times the disability is not seen, is not visible. Okay, you will not see a hemophilic with, let's say, amputated body limb or something like that. Though there are some patients who have lost their limb because the healthcare providers had very less knowledge about how to treat hemophilics, or there was a time when people didn't know about it. And now, even when many states have started to provide factor injections, the doctors there are still not aware how to treat patients with hemophilia. They are not aware of how the doses should be given. So coming back to empowering people with a disability, especially the rare conditions where most of the time the disability is not visible. Okay, so what happens again is, when we talk about today on the Disability Day, I would like to just touch a few points. I don't want to make this video too lengthy. Is that these patients, because of their deteriorating health or frequent health issues, are not able to complete their education. And because, see, now they are getting factor now. Okay, they are getting factor in most of the states now. They are getting factor. Okay, so now they'll be much better than what they were a couple of years or 5 years back. So now their health will improve. But again, what about the education? The education is not that good, right? So when people are not educated, what about the livelihood? They are still dependent on the family. And there are various issues, like one of the issue that comes into my mind is the banking system, where okay, you have a Jan Dhan system for people who are from the Grameen area, and it is a zero balance for BPL and all. Okay, right. what about the families and the patients who are rare disease patients? If their account is not maintained below and they have a below that particular fixed number, let's say 5,000 or 10,000, that is the standard. If they are not having they are not able to maintain that much amount in the account, they are charged, right? And again, because their health is not proper, they have to go to the hospital frequently. And that, where would they get the money from? Because they are not able to get the regular jobs or regular employment opportunities. They are not able to maintain the bank account also. So this is one of the problem, and we can in coming time I am going to discuss some of the important issues that are there regarding the healthcare and empowerment of people with rare diseases, and what could possible be there that the governments can take initiative, and as a society, when we talk about society, as a society can take the initiative, we could be more empathetic and more supportive to the people, because there are examples of patients who are doing well in their life because they have been given ample support. So disability, I would like to end with a note that disability may limit you something, but it does not stop you from living a good life and contributing towards the society and towards the world. So thank you so much. Jai Hind.